Dr. Tanaz Vaghaiwalla, and I'm an endocrine surgeon at the University of Tennessee Medical Center. I'm also an adrenal specialist and am thrilled to talk to you all about Adrenal Awareness Month. So April is Adrenal Awareness Month, and it's just a great opportunity to discuss adrenal disorders as well as educate and advocate for our patients with adrenal disorders. So as an adrenal surgeon, it is my absolute pleasure to speak a little bit about adrenal disorders with you today, and specifically adrenal tumors.
So can you start maybe by explaining what is an adrenal gland and what do they do really?
The adrenals are a set of two glands that we each have in our body. They are located just above the kidneys, and their responsibility is to secrete essential hormones that we need for everyday life. These hormones include cortisol, aldosterone, and medinephrines, as well as some other hormones. The function of these hormones are generally to maintain our normal salt balance, our blood pressure, as well as our fight or flight mechanisms. When patients have excess hormone secretion from these adrenal glands, they can develop severe symptoms such as headaches, chest pain, panic attacks, and weight gain. And excess of these hormones can lead to severe medical problems such as hypertension, stroke, diabetes, and heart attacks.
What is an adrenal gland tumor?
An adrenal gland tumor is essentially an abnormal growth or mass or nodule within the adrenal gland. These tumors can be separated into two broad categories, either functional adrenal tumors or non-functional adrenal tumors. Functional adrenal tumors are those that secrete extra hormones and can cause the symptoms and severe medical illnesses that we just talked about. Non-functional adrenal tumors are an abnormal growth of the adrenal gland, and either one of these sets of tumor types can either be cancerous or non-cancerous.
So how would I know if I have an adrenal tumor?
There are many ways that adrenal tumors can be identified. The most common way is actually by accident when patients are undergoing imaging, looking for or investigating other medical illnesses. And these adrenal nodules or masses are picked up on these scans. When that happens, patients should undergo a very extensive workup to determine whether these tumors are functional or non-functional, and we do that with a series of blood tests, as well as to determine whether there is a risk for cancer or not, and that can be done with specialized imaging for adrenal tumors. Now, these tumors are rare, and every tumor is different, and so in my opinion, referral to an adrenal specialist like a high-volume adrenal surgeon is absolutely essential to make a careful diagnosis and offer treatment.
Wonderful. When should adrenal surgery be performed, and what would a patient expect here at UT Medical Center?
So adrenal surgery, the decision to offer adrenal surgery is complex. Like we talked about, there are many different flavors of adrenal tumors, and the management differs depending on the type of adrenal tumor and, of course, patient factors. But in general, adrenal tumors that are functional in producing those extra hormones that we talked about should always be removed. Also, adrenal tumors that have reached a certain size, those pose a higher risk for cancer. And so in general, we offer surgery for adrenal gland tumors that are greater than 4 centimeters in size. But there are a number of other reasons to offer surgery. For example, patients whose tumor is growing at a rapid rate, or patients whose tumor have suspicious features on scans that would warrant surgery because of a concern for cancer. And again, at a center like University of Tennessee, I work with an incredible team of specialists to offer a range of treatments for these tumors. And seeking out treatment at a center that sees a high volume of adrenal disorders is highly recommended.
Wonderful. Thank you so much for your time, and anything else you want to add before we wrap up today?
Well, it was an absolute pleasure to speak with you all today, and I'm looking forward to hearing any of your questions.